Hi there, it's Tanya Wills, midwife in NYC, and welcome back to The Cancer Project. In this video, what I want to talk with you is about how I found my medical oncologist and what happened in my first meeting with her. So if you've been watching my other videos, you know that my cancer, which is invasive ductal carcinoma, estrogen and progesterone positive, HER2 negative, was found a few months ago, and I wound up having 2 surgeries. I had a lumpectomy and sentinel node biopsy. They didn't get clear margins, and they had to go back in again to get the rest of the cancer, and they also found cancer in my lymph nodes, so they took out 7 more lymph nodes, and I eventually found out the day after Christmas that the other 7 lymph nodes were negative and that they got clear margins. So needless to say, Christmas Day was an extremely difficult day for me. This is part of the terrorism that is cancer, is not knowing how far it goes. So just a little piece of education is that cancer can spread in your body 2 ways. One way that it can spread is through your lymphatic system, which mine had, right? So it went from my breast to one of my lymph nodes. And the other way that it can spread in your body is through your blood. And they don't really have any way of measuring if the cancer is or isn't in your blood, except for that when they actually take the tumor out and it goes to pathology, they can test to see if it has what's called lymphovascular invasion. And that means that there's some evidence that the cancer has escaped from the original tumor. We already knew that because it was in my lymph nodes, but they can't actually go into your blood and measure how much is there. And of course, when cancer travels through your blood, that's how cancer can travel to other places in your body. So the most common places where breast cancer can travel to is your bones, your liver, your brain, and your lungs. I have chemo brain. It's hard for me to remember these things. So once the cancer is out of your lymph nodes and is in other places in your body, that's stage 4 metastatic breast cancer. And we never want that to happen because there is no cure for that. And people who have stage 4 breast cancer, of course, many of them live for many, many years, but you will be in cancer treatment for the rest of your life. So when you have early stage breast cancer, which is what I have, they treat it to cure it, hoping that it will never come back, knowing that it's not in any other place in your body. So what happened for me was that after I received news that the lymph nodes were clear, they referred me to a medical oncologist, and I was feeling totally done with the way that this had gone down. I was exhausted with all of the bad news. I had been told over and over and over again that I probably wasn't going to need chemo and that I didn't need a mastectomy and all these things. And they just kept finding more cancer, and I was fed up. So a friend of mine said that she knew a nurse in the breast cancer unit at Memorial Sloan Kettering, and that if I was feeling uncomfortable, would I like to talk with her? And I talked with her, and she did get me in to see a doctor at Memorial Sloan Kettering much faster than any of the doctors that my surgeon recommended could see me. And quite frankly, when I called the offices of the places where my surgeon sent me, the receptionist was cranky, was not understanding, and I just was done. And I just have to say that through this whole process, it's been really hard for me to advocate for myself the way that I tell my own childbirth students to advocate for themselves. And, this is my life we're talking about here, and my life is hanging in the balance. And, it's really important to me that we get this taken care of as quickly as possible, and also that I feel that I'm being taken care of. And I think that that's a big thing. If you right now are not happy with your doctor or your surgeon or anybody in your team, is that there are hospitals and cancer programs where they specialize specifically in taking care of cancer patients and cancer patients only. And I kind of thought, oh, I don't need that, I'll be fine. But now that I have it, I totally see the difference. And so it's given me a lot more hope and a lot more courage going forward. So I had to get all of my records sent over to Memorial Sloan Kettering, including the actual slides from the pathologist. So it took a few weeks for me to get all of that done, but I did have that sent over, and I had my first appointment with my oncologist, who spent 2 hours talking with me and going through everything and helping me understand my own cancer and what would be best One of the things that my surgeon finally ran on my tumor is a test called MammaPrint. Another test that people sometimes will do is called Oncotype, but this is a test that will determine whether or not you would benefit from chemotherapy, or how we can reduce the risk of your cancer coming back if you receive chemotherapy. And my surgeon continually was telling me that she didn't think I was going to need it, that I was only going to need radiation. And when I sat down with my oncologist and I looked over the results of my MammaPrint, my results were right on the line, just at the lowest possible end you could be, considered high risk. So high risk for recurrence without chemotherapy. So with chemotherapy, my test results were showing that it would reduce my risk of recurrence by quite a bit. There's no way they can tell anybody with early stage breast cancer that they can bring their chance of recurrence down to 0. Not a mastectomy, nothing will do that for you. There's always a chance that the cancer can come back later in life. But there are things that they can do to try to lower that as much as possible. And she gave me a very, very good case for chemotherapy and a strong recommendation for it. And she went through it step by step. And I did tell her where I was getting some of my information, that I was a midwife, that I had access to the medical literature, that I was looking in up to date in other places. And she said, but it is very different to look at that information when you're sitting in the patient's seat, isn't it? And I said, yes, it is. So thank you so much for starting from the beginning like I'm anyone else. And she did. She went through everything. She explained to me how cancer spreads and what we don't want to happen, and the drugs that she was recommending for my chemotherapy, and the chemotherapy program that she recommended for me, the schedule, and why this is the best information. These are the best drugs that we have to give me the best chance of being rid of my cancer for good. So that was my plan, and just a totally, totally different experience there at Sloan Kettering. In the waiting room, they have coffee there. You can wait. A very lovely young man called me back into the exam room, and then every single person that I saw after that point, the nurse practitioner, and my doctor were all women taking care of me. And I know that these are not midwives, but I really felt like I was being taken care of like in a way that somebody would be taken care of in like a birthing center, just really holistically being cared for, being listened to, and addressing all of my concerns, taking the time. It was such a huge difference. So she made a strong recommendation for chemotherapy for 4 doses of acing, which is adriamycin and Cytoxan, and 4 doses of Taxol. As of sitting here with you today, I have had 2 doses of adriamycin and Cytoxan. I'll tell you more about that in another video. But in any case, that has been the plan. So before I started my first chemotherapy, I sat down with the nurse, and she gave me a whole bunch of teaching about what to expect. And my experience with chemotherapy so far has been very positive, and I've been able to exercise, and I've been able to work. I'm not catching babies right now, but I've been able to do a lot. I mean, almost everything. My brain is a little bit foggy. This video is probably going to get heavily edited. But that is what happened, and I feel totally, totally taken care of. My experience receiving chemotherapy at Memorial Sloan Kettering has been so positive. Everyone just so hopeful and helping to encourage me to minimize my side effects, continue on with my life. They've been helping me with that. So I just wanted to share with you and tell you about that, because I am talking about people not feeling comfortable with their care and advocating for themselves and feeling like they have a way to advocate for themselves in childbirth for the past 10 years of my life. And now it's something that I have to do for myself in my cancer treatment. And it was really, really challenging for me. I felt like I was bothering people in that surgeon's office. I felt like I wasn't getting clear answers. I felt like I was being rushed out of there a lot. And the change has been totally, totally different. So that is what happened at my oncologist's office. I'm going to be with this oncologist probably, for a long, long time. And then after I finish with my oncologist, then I'll move on to a radiation oncologist, because I'm probably going to need radiation as well. And I'll be reporting to you about that, but I haven't met them yet. One other thing that my oncologist did that really struck me So people have been saying to me since the very beginning of my diagnosis, oh, Tanya, I hope that you don't need chemo, or I hope that you don't need a mastectomy, or I hope that you don't need all these things that have a reputation for being so harsh in terms of treatment. And I have never felt that way. I have always felt like, let's find all of it and treat it so it never comes back. So that if chemo is the thing that I need, let's hope that they can see that. Or if a mastectomy is something that I need, let's hope that they can see that and that they find all of the cancer and that they get it all out. That's been really, really important to me. And with my surgeon, I always felt like something was missing. I felt like we didn't know if we had gotten it all with the lumpectomies that I had. Even though she felt that she did, I still felt like we were unsure. So my oncologist said, well, we don't have any radiographic evidence that shows that they got all of your cancer after your second surgery, after my re-excision, which was to get the clear margins and to take out the other 7 lymph nodes. So let's do an MRI. So that's what we did. We did an MRI of my left breast, and at the end of that, I got a call a couple days later saying that they found 2 little spots that were indeterminate areas and that they wanted to do a breast biopsy on those 2 spots. And, you know, I've been, knowing that I have cancer for 3 months now, I just feel totally surrendered to that process. I feel like, well, great, let's find out what they are so that we can take care of them and find out what to do about it. My right breast has still always been clear on imaging, so we're not finding anything there. It's just my right breast has my back. It's my left breast that's trying to get me. So I had the MRI guided biopsy with the radiologist, who's totally, totally awesome and explained everything to me. So I got there, they hooked up my IV because they have to give you the contrast basically so they can see what's going on with the MRI. So after my IV was done, the radiologist came in and she said, how are you feeling? And I said, I feel great because I took an Ativan today. I always take an Ativan before an MRI because being in a very enclosed space like an MRI tunnel is something that can make me have a panic attack. So I just decided I'm going to be on vacation that day. So I have a very, very low dose of Ativan that helps me through those tests. And the radiologist right away said, well, I like that. You're going to do great. So she explained to me the procedure, how I'll go into the tube and then I'll come out and then they'll make some marks. I'll go back in, I'll come back out, and then they'll do the biopsy. They always give you a numbing medication for the biopsy. It does not hurt. This one was even easier than the biopsy that I had, when I had my initial biopsy, core-needle biopsy. So it was much easier and it went really well. She said, do you understand what we're checking? And I said, I heard that it was 2 spots. And she said, it is 2 spots. And she told me that the spots are measuring very, very small. One was off the top of her head around 5 millimeters and the other one was about 3 millimeters. And she said, I don't think you're going to need a mastectomy or anything like that for this, but your surgeon will talk you through that if it turns out that these are cancerous. Sitting here with you today, I don't have any results for you. I'm supposed to get them probably on Monday. I'll tell you what I think they are, and then in the next video we can see if I was right. I think that these are 2 spots of DCIS, which is ductal carcinoma in situ, which is what they call stage 0 cancer. It's cancer that is not invasive, it hasn't spread to the rest of your body, and it hasn't shown its intent to spread, but left unchecked, of course, it can become that. So it does need to come out. It is, it's a thing they have a 100% cure rate for because it's not invasive, so it's not in my blood or anything. It's the old invasive cancer that we were more worried for the chemo about. So I'll keep you posted about that. At this point, I feel totally surrendered to whatever needs to happen, but I feel super grateful that my oncologist is looking and making sure that we're getting every single thing so we can treat this so I can be done with it and I can move on with my life. So that's where things are right now. My hair is falling out. It started falling out yesterday. I don't know when I'm going to shave my head. I don't feel ready to do it yet. I feel kind of sad about it, but I'm going to do another video on my hair. So I'll tell you more about that. I've been documenting that as I go along. In the meantime, take care. See you next time. Subscribe if you like what you're seeing and keep track of my progress. Take care.